What's Up, Doc? Mike, Public Health on Call, by Johns Hopkins Bloomberg School of Public Health. Today's topic for December 19, 2020, Dr. Michael Osterholm on rising cases, vaccine rollouts, and getting through. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith-Rogers, producer of the Public Health on Call podcast. Today, Stephanie Desmond talks to Michael Osterholm, director of the Center for Infectious Disease Research and Policy at the University of Minnesota and a member of President-elect Biden's COVID-19 Advisory Board. They talk about how tricky the next few months will be as cases keep rising and vaccines are slowly rolled out. Let's listen.
Mike Osterholm, thanks so much for joining me.
Thank you very much for having me.
So this week we are seeing the first COVID vaccines being delivered and given to healthcare workers. They're being touted as sort of the light at the end of this tunnel, but it feels like this is far from over.
You know, this is really the very best and the worst of times right now. And I think that there is this light at the end of the tunnel. I worry that we may have some train derailments before we get to the end of the tunnel. But nonetheless, having vaccines on the forefront right now is surely a something that we've all dreamed about in terms of responding to this pandemic. At the same time, before we have adequate vaccine available for the broad community around the world, we're going to see a lot of additional cases occur. The number of deaths will grow substantially. And we have to understand how can we best help our world go from this current time today to a day when hopefully most everyone will have had access to a vaccine and been willing to take it. That's going to be our real challenge.
So how do we get there?
I think, first of all, we have to be very careful with regard to the current vaccine efforts. And what I mean by that is I, like so many others, just want to celebrate this. I mean, I'm almost giddy. At the same time, we have to be very careful not to overpromise. Because when we overpromise, we give people the sense, well, we're just about there. I don't need to worry anymore about this. And then we go on and live our lives that unfortunately put us at high risk for transmission. I think right now the Christmas holiday season is a classic example of that. We are witnessing a tremendous impact that the Thanksgiving holiday season has had on case incidents. That really has become more clear each and every day, not only in number of new cases, but the number of hospitalizations. And unfortunately, a lagging indicator, deaths will occur over the future weeks ahead. How do we help the public understand that they have really within their control the ability to limit this transmission substantially? We don't need to wait for a vaccine. Mm-hmm. And that means that they basically have to be mindful of whenever they swap air with someone else, they put themselves at risk of becoming infected if that other person also may have been in swapping air with someone else, a third party who was infected. And so it's very hard, particularly when we're talking about family and holidays, to discuss this very issue. I mean, I tend to be pretty outspoken on it because I have seen the damage that can occur in families, in households, in neighborhood get-togethers, as we saw at Thanksgiving. And then at the same time, try to project into the Christmas holiday season, one where, you know, we're not trying to take Christmas away from you. This is our COVID year. This is our COVID Christmas, where if you really love your family, what you will do is not put mom and dad or grandpa and grandma or your brothers and sisters or your niece and nephews in harm's way. And, you know, I can't tell you how many times, again, I've heard from people who said, well, I never thought it would happen at our house at Thanksgiving. Mm-hmm. And it did.
Mm-hmm.
And already grandpa and grandmas and mom and dads are not going to be around for next year for the next year's Thanksgiving. So I think getting that message across to people that this is the COVID Christmas, where by loving your family the very most you can, you'll also do everything you can to make sure that you don't put people together in such a way as you expose them to this virus.
Mm-hmm. But you and others, and the CDC included, you told people not to travel for Thanksgiving, and they didn't listen.
Well, I have a bit of a different nuance that way. And again, let me be very clear. These are my own personal views. They don't represent my work on the Biden-Harris Advisory Board. But, I have spent my entire career on primary and secondary prevention. I was one of those people back in the early days with HIV/AIDS just saying no was not an answer. You needed to have that ability to have what could you do to absolutely protect yourself, but then what's the gradient after that? What is safer sex, for example? And I don't ascribe to that for this particular situation, because this is unlike asking someone to do this for a lifetime, or even for that matter, for a long period of time. We're asking people to get through one COVID Christmas, sacrifice for that. This is what Christmas is really all about, is sacrifice this year. And so I disagree that we should give people the idea that don't do it. But if you do it, this is how you should do it, because none of those recommendations really will stop transmission in a household full of people. Mm-hmm. And so I think it makes people feel good that they said, well, I'm following the CDC recommendations. They told me that, if I wasn't going to, I shouldn't do it. But if I did do it, I could have this kind of an outcome. And to me, that's, I look at that as in the analogy of public health prevention of telling someone don't drive drunk. But, oh, by the way, if you do, be sure you wear your seatbelt, try not to cross too many lanes at once, and, be careful when you're around the corners. Mm-hmm. And I would say that's not something we would ever do.
Right.
And so I think in this case right now, and again, it comes back to, as tragic as this is in terms of what happens when somebody brings the virus home that hasn't been bubbled for, 10 days, 7 to 10 days, etc., has also been tragic. I have unfortunately had to have the conversations with individuals who brought the virus home unknowingly, had the outbreak unfold, and now feel responsible. I killed mom or dad. I killed grandpa or grandma. I mean, the trauma of the actual transmission and what happened to the family is obviously, horrible. But then to know that you were the person that did it. And I tell people, unless you're prepared to live with that, really rethink this year and know that it's horrible. For the first time in 35 years, I am not going to read the Polar Express on Christmas Eve to my kids, even when they were young. As they moved into the adult years, I still read it. And now I read it to my 5 grandchildren. And this year, for the first time in those 35 years, I'm going to do it remote. I'm going to do it virtually. Mm-hmm. And, I can't imagine that. I mean, this is one of the most special moments of my life every year. Yeah. So I'm in that same boat. I get it. I understand that. But the bottom line is, if we want to address effectively the transmission issues around Christmas, we just have to accept what we have to do about it.
Mm-hmm. And I find it frustrating in my own personal life. I've got someone in my extended pod, I guess, who is insisting on traveling to the middle of the country this year. Cannot be talked out of it. And it's just very frustrating.
I have to tell you that, I don't even go back to the extent of saying, I told you so. I mean, that helps nothing after it's happened. Yeah. Other than to say that at Thanksgiving time, I did talk to multiple people who came to me almost as if somehow I would give them a dispensation and say, don't worry, you won't get infected, go do it, who traveled, who basically, in each of the instances I had, they didn't actually themselves get infected from the travel. But what they did is they got infected at the home from somebody else who traveled and then came back with it. Yeah. Now, and so I think your point's right on mark. And this is, again, this reality issue of just how prevalent this virus is right now. For people who are doing certain activities in the public to say, well, I haven't gotten infected yet. You know what? as an epidemiologist, I'll tell you, if you have a 1 in 1,000 chance of getting struck by lightning, that's one thing. But if it's 1 in 10, that's another thing.
Right.
And right now, the prevalence of this virus is so high in our communities out there that the things that you did literally months ago, or even some cases weeks ago, are not in the same risk category anymore, just because of the frequency with which people in the community are now infected.
Mm-hmm. So here's my question. We're hitting 300,000 deaths this week. Could we have avoided this?
That's a question that we're going to have to answer, I think, as we do the postmortem on this pandemic, hopefully better preparedness for the future. And one would have to argue, well, first of all, look at Asia. Look what they've done. They really knocked this down. And they put programs in place to do it. And some will say, of course, well, the authoritarian governments of Asia could do that. And I remind them of what Australia and New Zealand have done. And the fact that they're islands, I agree, gives them some advantage. But once it was established in both of those island countries, they did remarkable things to draw it down. And just last week, Australia had a big celebration opening the Christmas holiday season. And they're back to wide open. Mm-hmm. I look at even countries like Japan, where we've had more deaths on an average day in the last week in the United States than Japan has had total, even though population-wise, it's very, they're only a third of our population, but I mean, they don't see the same thing. So I think that we have to go back and ask ourselves, could we have done what the Asian countries did? And ironically, what the European countries did initially, and then got to midsummer and kind of really took the foot off the brake. And then they were in the same position we were in. Mm-hmm. So this is a question we're going to have to ask ourselves about ourselves. Mm-hmm. What are we as citizens of this country, so honoring and appreciating our freedom and liberty, willing to do? Mm-hmm. On behalf of the public's health, and of course our own health too. And I don't know what could have been done that way differently, but there is such a overall denial by so many that this is really the problem that it is, that makes it hard for I think the population to respond, as some of these other countries that have done so well have done.
Do you think part of it could be that we've really not had a national response and we've been using patchwork responses depending on where you live?
I do think that, a overall national framework would help. But, I've always said throughout my career, public health is local, just like politics, all public health is local. Mm-hmm. While we need national direction, in the end, it's convincing the public that this is an action we must take to preserve the public's health, and in that case, your own life. Mm-hmm. And ironically, we did do that in March and April. When it first happened, this idea of flattening the curve, rural America shut down, just like so many other areas of the country. The challenge is that in many parts of the country, COVID had not yet even shown up. And so they couldn't understand, why are we closed down for weeks and weeks and weeks? We don't have any cases. And I was saying back in last April, and I believed it in my heart of hearts, and unfortunately it's come true, is that ultimately there wouldn't be blue states and red states. There wouldn't be blue counties and red counties, or blue cities or red cities. They'd all be COVID colored. Mm-hmm. And today, if you go look at the map, you'll see it's all COVID colored. That came after a certain amount of what I call pandemic anger emerged, where people really felt like they had been sold a bill of goods because, the big box store can stay open 6 blocks away, but I got to close down my little hardware store here as part of trying to flatten the curve. And so I think we have to go back and look at those earliest days. Would we or could we have had a very different public response if, in fact, we really asked people to flatten the curve when it came time Labor Day and after that? Would we have been able to do that? And I think to a certain degree, we really almost poisoned the well in terms of public will and a willingness to do something about the pandemic activity by what happened in the spring.
Can we redeem ourselves at this point?
Well, I always believe failure is not an option when you're dealing with a situation like this. So I think we have to keep working on it. It will be important as a society understanding what motivates people, what doesn't. We all know that this pandemic was laid upon already a very fragile and sensitive political situation. And far too often, the public health issues that should have been just those got basically conflated with the politics of the day. And that was an unfortunate situation that really hardened people into positions that didn't having to do with public health. I mean, a good example is just our previous conversation. For the last several weeks, if you follow the Twitter world or my emails or whatever, you can see how many people are very, very angry with me, thinking I'm trying to take away Christmas from them. Somehow I'm trying to limit their religious freedom. And it's not. I'm just trying to make sure that they still have family members here next year that otherwise wouldn't be here if they go ahead and do what they're doing.
Right.
And it just was so easy to get that message tied into a political statement. This is not about religious freedom. This is about what can I do to help you protect your family.
Mm-hmm. So I guess my last question is, what should we expect going forward? When do we go back to some sort of normal?
Well, at this point, it's going to be a combination of two things. One is how much vaccine and when is it available? The second thing is who's going to take the vaccine? I have argued for some time that the last mile of getting the vaccine from the manufacturer into the community is a challenge with these vaccines, but one that, we're up to doing if we have the resources, which right now still are very limited for the states. But the part that has concerned me most is the last inch. It's getting the needle in the arm. Will we actually accomplish that? And today, we have seen in the general public a level of vaccine hesitancy that's very concerning. When we look at even risk groups like healthcare workers, we've seen recent surveys suggesting up to 34% of physicians are considering waiting for the first 6 months to see what the safety profiles of the vaccines actually look like before they get vaccinated. Well, if that's the case, that's going to translate directly to their patients. We've seen the same numbers, even slightly higher with nurses. I'm involved with several efforts right now in outreach to the Black, Indigenous, and persons of color communities. And when we look at young Black men today in this country, in some locations as high as 75% say, no way, this is Tuskegee all over again. And so it's going to be really important that we learn through our studies of their knowledge, attitudes, and beliefs in our society, what are the challenges to getting people vaccinated and what can we do about that in a very proactive way? And just don't assume because you make it, they will come. That's not the case. They won't.
Mike Osterholm, thank you so much for joining me.
Thank you.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.